You're hoping to quickly get your head around something important, maybe even a little surprising, right? Without getting too bogged down.
That's the idea.
Good. That's what we do here. Today, we're diving into a topic you might not think about often. Ethanol toxicosis.
Right, ethanol. It's that short-chain alcohol. We mainly know it from drinks, obviously.
Hmm.
But it also pops up elsewhere, solvents, for instance, and it's produced during fermentation. We've been looking through some pretty technical medical info on this.
And our aim is to pull out the really crucial bits for you, maybe some unexpected insights, too.
Exactly. So the mission today: understand the basics of ethanol toxicosis. What causes it? What are the signs? What are the key things to really keep in mind?
Okay, let's unpack this then, starting with ethanol itself. What exactly is it, chemically speaking?
Well, at its core, it's a chemical that mixes really, really easily with water. Think about how alcohol just disperses in a drink, you know?
Okay, highly miscible.
Yes. And it's less volatile, less prone to evaporating than some similar chemicals' uses. Beyond beverages, it's a solvent in quite a few medications. And here's a surprising one. It's sometimes used intravenously to treat ethylene glycol poisoning. That's antifreeze poisoning.
Wow. Okay, that is unexpected. Using one alcohol to treat poisoning from another.
Sort of, yeah. But you also mentioned denatured forms earlier. What's the important thing there?
Ah, right. Denatured alcohol. The key thing, really, is that it's ethanol mixed with other stuff to make it undrinkable. And that other stuff can be pretty nasty.
Nasty how?
Like acetone, benzene, methanol, sometimes even kerosene or sulfuric acid, really toxic things.
So if an animal ingests denatured alcohol, it's not just ethanol poisoning you're dealing with.
Exactly. It can be much more complex, much more severe because of those added toxins. It muddies the waters, clinically speaking.
Got it. That's a critical distinction. Now, we hear the term proof with alcoholic drinks. What does that actually mean?
It's simply a measure of the alcohol concentration. Easy rule. Proof is just double the percentage of alcohol by volume.
Okay, so 40% alcohol is 80 proof. Simple enough.
Yep. And regarding how much is dangerous, the acute oral lowest toxic dose reported is around 5 to 8 milliliters of pure ethanol per kilogram of body weight.
Which sounds like a tiny amount.
It does, but remember that's pure ethanol. You always have to factor in the percentage in whatever was actually consumed. A little bit of a high-proof liquor is very different from the same amount of beer.
Right, context is everything. Are there other similar alcohols we should be aware of? Isopropanol, maybe?
Definitely. Isopropanol, that's rubbing alcohol and methanol, which you find in some industrial solvents or fuels. They're important too.
And are they more or less toxic than ethanol?
Well, methanol's toxicity is generally considered pretty similar to ethanol. Isopropanol, on the other hand, is thought to be about half as toxic, roughly, but they all cause problems.
Okay, so we know what it is, roughly how much is bad. But how does ethanol actually cause harm? What's the mechanism?
The main issue is damage to cell membranes all throughout the body.
Right.
And it really messes with nerve conduction. It disrupts the normal flow of sodium and potassium ions across nerve cell membranes.
So it interferes with the electrical signals in the nerves?
Exactly. Like static on the line, making it hard for signals to get through properly. There's also evidence it might inhibit certain glutamate receptors in the brain, which are involved in excitation.
So hitting the nervous system hard. Who tends to be most affected by this? Any particular group?
Our sources point mainly to dogs. Seems to be the most common species reported.
Any particular breed or age?
No specific breed or sex predisposition mentioned, interestingly. But younger animals are definitely highlighted as being more susceptible, more sensitive to the effects.
Okay, dogs, especially young ones. Now, exposure. How does it usually happen? I mean, spilled drinks seem obvious.
That's a big one, for sure. But the list of potential sources is surprisingly long. Things like dyes, ink, disinfectants.
Disinfectants? Like hand sanitizer?
Could be, yeah. Also gasoline, mouthwashes, paint, varnishes, perfume, even pharmaceuticals that use alcohol as a solvent. It's quite a range of common household stuff.
Wow. Perfume, paint, things you wouldn't immediately think of. Any other sort of unusual sources?
Oh, absolutely. The classic one is fermenting bread dough.
Bread dough, how does that work?
Well, if a dog eats raw bread dough, the yeast inside starts fermenting the sugars right there in the warm environment of the stomach.
And produces ethanol.
Exactly. So the dog gets intoxicated from the inside out, basically. But there's another danger with dough.
What's that?
The dough keeps rising, expanding in the stomach. This can lead to gastric dilatation or bloat, which is a life-threatening emergency on its own.
Good grief. So the dough is a double whammy: poisoning and bloat risk.
Precisely. Definitely something to be aware of if you bake bread.
Okay, so if an animal has been exposed, what signs should we look for? What are the clues?
The central nervous system signs are usually the most prominent,
Mm-hmm.
and they tend to show up pretty fast.
How fast?
If they ingest it on an empty stomach, maybe 15 to 30 minutes. If they'd eaten recently, it might be delayed a bit, maybe 1 to 2 hours.
And what would those signs look like?
With higher doses, you'd likely see ataxia that's incoordination, wobbliness, stumbling,
Okay.
reduced reflexes, maybe behavioral changes. They could become unusually excited or sometimes quite depressed. And hypothermia, a drop in body temperature that's common too.
Right. Any signs specific to the source? You mentioned the bread dough.
Yeah, with bread dough, you might notice a lot of gas, flatulence. Also, polyuria, increased urination, or even incontinence, losing bladder control can happen.
And if it progresses, what are the really serious signs?
In severe cases, you can see worsening depression leading to narcosis where they're very hard to wake up. Their breathing rate can slow down significantly.
Oh, that sounds dangerous.
It is. And they can develop metabolic acidosis, a buildup of acid in the blood. Ultimately, it can lead to cardiac arrest and, unfortunately, death.
A very serious situation. Let's circle back to the causes quickly. We mentioned spilled drinks, household products.
Right. Accidental ingestion of alcoholic beverages is probably the most common scenario. Spills, drinks left unattended. Also, alcohol-containing medications not stored properly.
Right.
And sadly, we have to mention intentional exposure.
People deliberately giving alcohol to animals.
Unfortunately, yes. Maliciously, or sometimes misguidedly thinking it's funny. And it's worth remembering, apparently dogs often quite like the taste of beer and might drink it willingly if they can access it.
That's disturbing, but important to know. What about those less obvious ones again?
Fermented things, definitely. The bread dough, as we discussed. Also, things like rotting apples or other fermenting fruit, especially in orchards or compost heaps, can produce enough ethanol to affect smaller animals.
Rotten apples.
And don't forget spin exposure. If an animal gets soaked in, say, rubbing alcohol or another high-concentration product, enough can be absorbed through the skin to cause toxicity.
Right, dermal absorption. Good point. Okay, so suspicion arises. How do vets actually diagnose this, given the signs could overlap with other things?
Yeah, that's the challenge. The differential diagnosis list is quite broad.
Yeah.
You've got to rule out other toxic alcohols like methanol or isopropanol, exposure to recreational drugs, maybe early-stage antifreeze poisoning, which could look similar initially.
Lead solvents, pesticides.
Certain solvents, yes, and even some pesticides can cause neurological signs. So a thorough history and assessment are key.
What about lab tests? What can they tell us?
Basic blood work helps. Packed cell volume, total solids give a general picture. Blood glucose is critical hypoglycemia. So low blood sugar, specifically below about 60 milli-GDL, is a serious potential complication we need to watch for.
Okay. And the acidosis.
Right, the metabolic acidosis. It's thought to be mainly due to ethanol increasing lactic acid production, a lactic acidosis.
Can you test for ethanol directly?
Yes, absolutely.
Sure.
Blood ethanol testing is available and very useful. Levels associated with clinical signs.
Well,
They vary, but in puppies, signs might appear above 0.6 milli-GML, while in adults, it's often in the range of 1 to 4 milli-GML.
and blood gases.
Blood gas analysis is really helpful for confirming and quantifying the metabolic acidosis. You'll typically see a decreased blood pH and often an increased anion gap.
Right. So we have a diagnosis or strong suspicion. What about treatment? Is there like an antidote?
Unfortunately, no specific antidote in the way we think of them for some other poisons. And this crucial activated charcoal doesn't work for ethanol.
No activated charcoal. That's surprising. It's used for so many other toxins.
I know, but it just doesn't bind well to ethanol. So giving it is generally not recommended. It won't help.
Okay, good to know. So what are the mainstays of treatment?
Well, if the ingestion was very recent and the animal is still conscious and has a protected airway, inducing vomiting or performing gastric lavage, pumping way, the stomach might be considered.
Cautiously.
Very cautiously. Risk of aspiration is high if they're already drowsy. If breathing is significantly depressed, supporting ventilation is paramount, maybe even mechanical ventilation.
And fluids.
Absolutely. Intravenous fluids are key to manage dehydration, support blood pressure, and help flush things through.
What about correcting that metabolic acidosis?
We might use sodium bicarbonate intravenously, but again, it needs careful calculation and administration, usually based on the severity of the acidosis, ideally guided by repeated blood gas measurements.
So you calculate a dose, maybe give half, and recheck.
Exactly. Give half the calculated deficit slowly, then reevaluate with blood gases before giving more. You don't want to overcorrect.
Makes sense. Any other medications that might come into play?
Well, if cardiac arrest occurs, standard CPR protocols apply, which includes drugs like epinephrine and bicarbonate.
Okay.
There are also some reports, though it's not a standard-approved treatment, suggesting yohimbine might help reverse the CNS depression from ethanol.
Yohimbine. That's sometimes used to reverse certain sedatives, right?
Exactly. The dose mentioned is pretty low, around zero point 0.1 millikilogram IV. The catch is that yohimbine has a short half-life, so the effects might wear off, and repeat doses could be necessary. But it's something mentioned in the literature as potentially useful.
Interesting. What about Fempizole, the antifreeze treatment drug? Does that work?
Fomepizole works by inhibiting the enzyme alcohol dehydrogenase, which breaks down ethylene glycol. It also breaks down ethanol. So theoretically, it could slow ethanol metabolism.
Odd.
But it's not generally recommended or considered standard of care for ethanol toxicosis in animals. Its main use is clearly defined for ethylene glycol.
Got it. Are there any treatments that are definite no-nos, things to absolutely avoid?
Yes. Avoid giving any other drugs that cause central nervous system depression. Things like certain sedatives or tranquilizers could make the ethanol-induced depression much worse.
Okay, that's logical. So after starting treatment, what's the focus for ongoing care?
Primarily monitoring. Keep a close eye on blood pH, blood gases, urine pH, and the anion gap to track the acidosis. Monitor temperature, heart rate, respiratory rate, neurological status.
And how long does recovery usually take?
Generally, if treatment is successful, recovery from the main clinical signs often happens within about 8 to 12 hours.
Okay, so let's try to sum this up. Ethanol, super common substance, but it can be seriously toxic, especially to pets.
Right. And the sources aren't just the obvious ones. Think household products, perfumes, disinfectants, even rising bread dough or rotting fruit.
And recognizing those signs, the wobbliness, the depression, low temperature is key. Plus knowing that some standard poison treatments, like activated charcoal, just aren't effective here.
Exactly. I think for me, the real eye-opener is just that sheer range of unexpected sources. That cleaner under the sink, the dough on the counter.
It widens the perspective on potential household hazards, doesn't it?
It really does. And for you listening, hopefully this knowledge gives you a valuable lens to view potential risks you might not have considered before.
Which does make you think, doesn't it? Given how ubiquitous alcohol is, what other things that seem harmless, things we have all around us, might actually pose hidden risks we're not fully aware of? How can we get better at spotting those hidden dangers?